thank you very much to Thrombosis UK for the opportunity to present on the CHAPS study, which is an NIHR HTA-funded randomized controlled trial evaluating the role of compression hosiery for the prevention of post-thrombotic syndrome. The chief investigator for the study is Professor Alan Davies, Professor of Vascular Surgery at Imperial College London, and my name is Sarrah Peerbux, and I'm currently managing the CHAPS study. So why are we conducting the CHAPS study? Well, in terms of just a brief bit of background, deep vein thrombosis occurs in approximately 1 to 2 per 1,000 adults in the UK, and just under 50% of these individuals diagnosed will then go on to develop something called post-thrombotic syndrome, or PTS. And post-thrombotic syndrome is a common complication of being diagnosed with a DVT, and it's a chronic and potentially disabling condition that can have a negative impact on the patient's quality of life, with symptoms including pain, edema, and skin changes. So it's an important clinical problem. NICE guidance currently states that the current standard of care for anyone diagnosed with a DVT is the prescription of anticoagulation, usually for a period of 3 months. And up until about 6 years ago, graduated compression stockings were also recommended as standard, but that's now longer than case. And this is due in part to the inconsistent evidence relating to the role of compression stockings, with some studies demonstrating the benefit of compression stockings for preventing post-thrombotic syndrome, and other studies showing that they're actually of no benefit at all. And there's also some variability in clinical practice globally, with compression stockings recommended as standard in Europe, but not in the UK or the US. Two of the main criticisms of these previous studies has surrounded the issue of adherence. So some studies have shown that patients just don't wear their stockings, and other studies aren't collecting the data necessary to inform adherence. And one of the important points of the CHAP studies are actually working with a team of behavioural scientists at University College London to ensure we're systematically assessing adherence, we're investigating the barriers and facilitators to wearing stockings, but we're also incorporating a series of adherence support interventions that we hope will encourage patients to wear their stockings in the long term. So the main aim of the CHAP study is to determine or measure the difference in the incidence of post-thrombotic syndrome at a median of 18 months follow-up after the diagnosis of the first acute DVT, comparing the control arm, which is anticoagulation alone, and the intervention arm, which is the provision of compression stockings in addition to anticoagulation. In terms of the eligibility criteria, patients are eligible if they are over the age of 18 and if they're diagnosed with their first symptomatic lower limb DVT, which must be less than 2 weeks from imaging confirmed diagnosis. Patients are excluded for a variety of reasons, including a contraindication to the graduated compression stockings or anticoagulation, if their ABPI is less than 0.8, or if there's the absence of pedal pulses, or if they have previous chronic venous insufficiency defined as C5 or C6 as per the SEEP classification. The primary outcome is any incidence of post-thrombotic syndrome using the validated Villalta criteria over the median 18-month follow-up. And secondary outcomes include any incidence of venous ulceration, also measured by the Villalta, changes in disease-specific and generic quality of life, self-reported adherence to anticoagulation and stockings, and will also be conducting a cost effectiveness analysis as well. So in terms of progress to date, recruitment commenced in March 2020, and we've recruited 58 participants to date, and that's out of our total target sample size of 864 participants. Much like many studies, unfortunately, recruitment has been quite severely impacted by the COVID pandemic, but the good news is things seem to be moving in the right direction, with activities slowly opening up again. We have 14 sites open to recruitment across the UK, and we're looking for additional sites in setup. So if you are interested in getting involved in recruiting to the CHAP study, then do let us know. In terms of what you'll receive, sites will receive £145 per patient randomised. There'll also be fees provided for each individual enrolled in the separate qualitative sub-study. and we'll also be reimbursing any patient travel expenses. Full training will also be provided on both study procedures and on the provision of stockings, so the measuring and fitting of stockings. And the stockings and donning aids will also be provided free of charge to the site. And this study is also registered for the NIHR Associate PI scheme, which is a really good way of getting clinicians involved in clinical research and clinical research delivery. So if you are a principal investigator, or if you are a research team interested in recruiting to the CHAP study, please don't hesitate to get in contact with us, or if you'd like more information on the study, again, my contact details are here and I'd be delighted to hear from you. Thank you very much.